If you're a woman over 60, your heart changed the day menopause began. But here's what your doctor probably never told you. One tiny seed can reverse years of that damage. The science is real, and it starts in the next 60 seconds. If you are a woman over 60, your heart has been quietly changing since the day your estrogen levels began to fall. Most women are never told this. Most doctors do not sit down and explain what menopause actually does to the cardiovascular system at a cellular level. They talk about hot flashes. They talk about sleep disruption and mood changes. But the conversation that matters most, the one about what is happening inside your arteries, inside the walls of your blood vessels, inside the very tissue that keeps your heart beating, that conversation almost never happens. And that silence is costing women their lives. Here is what the science shows. Estrogen is not simply a reproductive hormone. It is one of the most powerful vascular protective compounds your body has ever produced. For decades, from your teenage years through your 40s, estrogen was quietly working inside your blood vessel walls, keeping them supple, flexible, and responsive. It was reducing inflammation. It was signaling your endothelial cells, the delicate single-cell lining that coats every artery in your body, to stay healthy, to repair themselves, to resist the kind of damage that leads to plaque buildup and heart disease. Estrogen was, in every biological sense of the word, your heart's guardian. And then menopause came, and that guardian stepped away. When estrogen levels drop, the endothelial cells that line your arteries begin to lose their resilience. The inner walls of your blood vessels, which once responded quickly to changes in blood flow and pressure, become slower to react, stiffer, less elastic. This is called endothelial dysfunction, and it is not a dramatic event. You do not feel it happen. There is no pain, no visible symptom, no alarm going off. It is a slow, invisible process that unfolds over months and years. But the consequences are anything but invisible. Stiff arteries mean your heart has to work harder to push blood through your body. Stiff arteries mean blood pressure rises. Stiff arteries mean the small tears and micro-injuries that naturally occur in vessel walls do not heal as efficiently, and that is where inflammation takes hold and where the early stages of cardiovascular disease quietly begin. What makes this even more urgent is that women over 60 are statistically undereducated about their own heart disease risk. For generations, heart disease was framed as a man's problem. Research was conducted predominantly on male subjects. Clinical trials enrolled male patients. The symptoms women experience during a cardiac event, fatigue, nausea, jaw pain, a feeling of pressure rather than crushing chest pain, were routinely misdiagnosed or dismissed. So not only has the biology been working against women after menopause, the medical system has historically failed to recognize it with the urgency it deserves. But here is where the story changes. Here is where the science gives us something genuinely powerful to work with. My research, and the research of hundreds of scientists working in the field of food as medicine, has demonstrated something that reshapes everything we thought we knew about aging and the heart. Certain plant compounds have the ability to interact directly with the genes that govern vascular health. They do not just reduce symptoms, they communicate with your DNA. They activate pathways that promote the production of nitric oxide, the molecule your blood vessel walls use to stay relaxed and open. They reduce the inflammatory signals that accelerate arterial aging. They support the microbiome in your gut, which in turn produces metabolites that circulate through your bloodstream and protect the heart in ways that no pharmaceutical has ever fully replicated. This is not alternative medicine. This is not a wellness trend. This is peer-reviewed, published, reproducible science. And the most exciting part of it, the part that I find myself returning to again and again in my work, is that the most powerful of these compounds are not locked inside expensive supplements or cutting-edge therapies. They are sitting in foods that have existed for thousands of years, foods that your grandmother may have eaten without ever knowing the molecular reason why they were good for her heart. The seed we are going to talk about is one of the most studied functional foods in cardiovascular research. Its compounds have been examined in clinical trials involving postmenopausal women specifically. The results are not anecdotal, they are measurable, they are consistent, and they point towards something that every woman over 60 deserves to know: that the damage menopause did to your heart is not permanent, that the body retains a remarkable capacity to heal when you give it the right biological instructions, and that those instructions can come from something as simple, as accessible, and as ancient as a single seed. I want you to think about your gut differently than you ever have before. Most people, when they think about digestion, think about food going in and waste coming out. They think about bloating and discomfort and maybe probiotics. But what the science has revealed over the last 2 decades is something far more extraordinary than that. Your gut is not simply a processing system. It is a living, dynamic biochemical laboratory, one that employs trillions of microbial workers, each one capable of transforming the food you eat into compounds that travel through your bloodstream and communicate directly with your organs, including your heart, including your arteries, including the very cells that determine whether your cardiovascular system ages gracefully or deteriorates ahead of its time. This understanding changes everything about how we think about food as medicine, because it means that when you eat something, you are not just feeding yourself, you are feeding your microbiome. And what your microbiome does with that food, the metabolites it produces, the signals it sends, the molecular conversations it initiates, determines a significant portion of your health outcomes in ways that science is only beginning to fully map. Flaxseed sits at the center of this conversation in a way that few other foods do. And when I say flaxseed, I am not speaking loosely or relying on folk wisdom. I am speaking about a food with one of the most robust bodies of cardiovascular research attached to it in the entire field of nutritional science. The reason comes down to a class of compounds called lignans. Flaxseed contains more dietary lignans than any other food source on the planet, roughly 800 times more than most other plant foods. That is not a small difference. That is a biological distinction that makes flaxseed genuinely unique in what it can do inside a postmenopausal woman's body. Here is the mechanism, and I want you to follow this carefully because it is remarkable. When you consume ground flaxseed, the lignans it contains pass into your large intestine. There, specific strains of your gut bacteria, particularly those in the Ruminococcaceae and Lactospiraceae families, metabolize those lignans and convert them into two compounds called enterodiol and enterolactone. These are called phytoestrogens, but that word can be misleading. They are not estrogen. They do not behave like synthetic hormone replacement. What they do is bind selectively to estrogen receptors in your blood vessel walls, the same receptors that before menopause were activated by your body's own estrogen to keep your arteries healthy and flexible. They activate those receptors gently, partially, in a way that research suggests triggers the vascular protective effects of estrogen without the risks associated with hormone therapy. This is your gut acting as a pharmacy. This is your microbiome, given the right raw material, producing a compound that your ovaries no longer make in sufficient quantities. And the implications of that are profound, because it means that part of what menopause takes away, specifically the cardiovascular protection that estrogen provided, can be partially, meaningfully restored through what you choose to put on your plate. The clinical evidence supports this with a consistency that is difficult to ignore. Published studies in peer-reviewed journals, including the American Journal of Clinical Nutrition and Menopause, have documented that postmenopausal women who consume flaxseed regularly experience measurable reductions in LDL cholesterol, the type associated with plaque buildup in arterial walls. Other studies have shown significant reductions in systolic blood pressure, which is the pressure your arteries experience when your heart contracts. Arterial stiffness, measured using a technique called pulse wave velocity, has been shown to decrease in women who consume flaxseed consistently over a period of weeks. These are not soft, subjective outcomes. These are hard, measurable physiological changes happening inside the body, and then there is the anti-inflammatory dimension. Chronic low-grade inflammation is now understood to be one of the primary drivers of cardiovascular disease in postmenopausal women. Estrogen, when it was present in sufficient quantities, acted as a natural brake on inflammatory pathways. When it fell away, inflammation was allowed to rise. Flaxseed's lignans, once converted to enterolactone by the gut microbiome, have been shown in multiple studies to reduce circulating levels of C-reactive protein, one of the most widely used biomarkers of systemic inflammation. They also modulate the activity of certain inflammatory cytokines that, when left unchecked, accelerate the damage to arterial walls that leads to atherosclerosis. What this means, taken together, is that flaxseed is not working through a single pathway. It is working through multiple biological systems simultaneously. The endocrine system, the inflammatory system, the lipid metabolism system, and the vascular system all at once, all because of what your gut microbiome does with 2 tablespoons of a seed that costs almost nothing and fits in the palm of your hand. The most transformative health decisions you will ever make are rarely the dramatic ones. They are not the surgeries, not the prescriptions, not the expensive interventions that happen inside a hospital. The most transformative health decisions happen in your kitchen, at your grocery store, in the quiet and ordinary moments when you choose what to put into your body. And what science has shown us, repeatedly and with increasing precision, is that those small daily choices accumulate into biological outcomes that are just as powerful and in many cases more sustainable than anything a pharmaceutical can offer. This is not a philosophy. This is what the data shows. And when it comes to protecting the heart of a woman over 60, the data points clearly and consistently toward one of the simplest protocols in all of nutritional medicine: 2 tablespoons of ground flaxseed per day. That is the dose that appears most consistently across the clinical literature examining flaxseed's cardiovascular effects in postmenopausal women. Not a handful, not a cup. 2 tablespoons, roughly 14 grams of ground flaxseed, consumed daily, with consistency. The emphasis on ground is not incidental. Whole flax seeds pass through the digestive tract largely intact. The hard outer shell protects the interior compounds from being broken down and absorbed. When you grind the seed, you break that shell open and make the lignans, the omega-3 fatty acids, and the soluble fiber bioavailable, meaning your body can actually access them, absorb them, and put them to work. Whole flax seed sitting in your cabinet is potential. Ground flaxseed consumed daily is medicine. The delivery method matters far less than the consistency. This is important to understand because one of the most common barriers people face when adopting a new nutritional habit is the belief that it has to be complicated, that it has to fit into a specific recipe or routine, that if they cannot do it perfectly, they should not do it at all. That kind of thinking is the enemy of progress. Ground flaxseed has a mild, slightly nutty flavor that disappears almost entirely when added to other foods. 2 tablespoons stirred into your morning yogurt. 2 tablespoons blended into a smoothie with berries and almond milk. 2 tablespoons mixed into your oatmeal while it is still warm. 2 tablespoons folded into a bowl of soup. The vehicle does not matter. What matters is that it enters your body, reaches your gut microbiome, and initiates the biochemical cascade that your cardiovascular system is waiting for. The timeline the research points to is 12 weeks. That is the window in which measurable changes begin to appear in the clinical studies: reductions in LDL cholesterol, improvements in arterial flexibility, decreases in blood pressure, reductions in inflammatory markers. 12 weeks is 3 months. It is 1 season. It is a period of time short enough to feel achievable and long enough for your biology to respond in ways that show up in your blood work and in how your arteries function. This is not a lifetime commitment you are being asked to make before you see any evidence. This is a 12-week experiment that the science strongly suggests will produce results you and your doctor can measure together. What is happening inside your body during those 12 weeks is a process of genuine biological renovation. Your gut microbiome, consistently supplied with the lignans in ground flaxseed, is producing enterolactone in increasing quantities. That compound is circulating through your bloodstream, binding to estrogen receptors in your blood vessel walls, and triggering the vascular protective responses that those receptors have been waiting to receive since your estrogen levels declined. Your endothelial cells, the inner lining of your arteries, are receiving signals to reduce inflammation, to produce more nitric oxide, to maintain their structural integrity. The soluble fiber in flaxseed is simultaneously binding to bile acids in your digestive tract, forcing your liver to pull LDL cholesterol from your bloodstream to synthesize new bile acids, which is one of the most well-understood mechanisms by which dietary fiber reduces cardiovascular risk. And the alpha-linolenic acid, the plant-based omega-3 fatty acid that flaxseed contains in significant quantities, is being incorporated into your cell membranes, making them more fluid, more responsive, more capable of the kind of dynamic function that healthy cardiovascular tissue requires. All of this is happening because of a 2-tablespoon habit. All of this is happening because you gave your body the raw materials it needed to do what it was always designed to do: protect itself, repair itself, and sustain the organ that has been beating for you every second of every day since before you were born. The body is not passive. It is not simply aging toward decline on a fixed trajectory that cannot be altered. It is actively responsive to the inputs you give it. And the research on flaxseed in postmenopausal women is one of the clearest demonstrations of that responsiveness that nutritional science has ever produced. This is what eating to beat disease looks like in practice. Not a dramatic overhaul, not an elimination diet, not a supplement stack that costs hundreds of dollars a month. A seed, ground, 2 tablespoons every day. And the science behind it is as serious, as rigorous, and as clinically validated as anything you will find in a medical journal, because that is exactly where it comes from.